You are watching Wide Field with Vivian Birchall. This is Wide Field.
Welcome to Whitefield. I'm Vivian Kobusingye Birchall, your host, and my guest is Dr. Brenda Kubekha of Health IQ Consulting in South Africa. Dr. Kubekha, welcome to the show.
Thank you, Vivian, and thank you so much for having me.
It's a pleasure. Please tell us more about yourself and your professional background.
I'm a South African-based physician and have worked in healthcare for more than 20 years. And for the last 11 to 12 years, I've been working in clinical risk management and ethics in healthcare. So basically, we work with health professionals and healthcare facilities in the background, providing advice and also assisting in improving quality and managing the risk in facilities.
Well, skincare is a significant aspect of our lives because it clearly sets our identities apart. It is something that cannot be changed. And however, in many ways, skin color shapes human relations in almost all parts of the world. Over the years, people with darker skin pigmentation have faced numerous unpleasant experiences. And today, we will focus on the impact of the skin color on the quality of healthcare. We will look at the invisible and structural barriers to access to quality care. So back to Dr. Kubekha. What are some of the ethical issues and challenges in bioethics?
The challenges specifically related to skin color, it has to do with the issue of, I'll say, discrimination. Basically, treating people of a different skin color differently, whether it is because of, implicit bias, which is unintentional, or because of prejudice. But what is important is that in healthcare, we are supposed to treat each and every patient with dignity and provide the same kind of care, and also ensure that we do not harm patients where possible. So sometimes the skin color can actually be a facilitator of harm, where patients are provided with, quality care that is less compared to, other patients from a different group.
And as a doctor, as a physician, what have been some of your observations over the years on healthcare access for Black people in South Africa and also the rest of the world?
Mm-hmm. I'd say that access is mainly dependent on national policy that guides the provision and also the access to care. But in reality, and that's why in healthcare we talk about social determinants of health, of which race and social class are some of the determinants, where you find that let's say, Black people are a minority, and that impacts on how they perceived in certain communities, and also where they get to be positioned geographically. Thus, that having an impact on how easy it is for them to actually access the care, And if we look at it politically as well, I mean, looking at our country, South Africa, we just came out of apartheid, like 20 more than 25 years ago. But the structural racism is still present. Firstly, I'll just talk about my experience as a patient, when I was younger, with a chronic ear problem and having to attend a hospital on a regular basis, a specialist clinic on a regular basis. But back then we had a tiered system where we had healthcare services for white people and for non-white people. And also resource allocation was different. And, and the practitioners and the doctors were of a different skin color. So as a young patient, and I would say empowered because I wanted to ask questions, I wanted to engage and be part of decision making in my own care, but I would find that this one particular, doctor will just treat me as an object. I'll ask questions, literally he'll just stare at me and turn my ear and look at my ear and not say anything, and just, write notes and prescription, and that will be just the end of it. And I'm actually not surprised that the work that I do today also has some sort of link to my, experience as a patient.
Can you first describe some of your medical training as a physician, including textbooks, research journals, and how these have influenced your professional knowledge and approach to treatment and care?
Mm-hmm. First, I must thank you for that article that you wrote, because it just challenged how I personally, looked at skin color in healthcare, So because our training is influenced by the West, we use textbooks from Europe. Yes, we're in Africa. We use textbooks from Europe and textbooks from the US. So the pictures that you see there, it's the pictures of white people, and when it comes to describing symptoms, especially when it comes to skin conditions, also it does not reflect the diversity of the society, where if we talk about a mole, and the advice would be if your mole gets darker or turns purple. And the question is, if you are dark skinned, how do you identify, purple? And what is darker of a very dark skin, So I think it's just some of those issues that have been normalized by the training, and us as trainees and also as medical professionals finding our own way of filling the gap, which also presents problems, because if it's left to individuals, all of us will interpret symptoms differently and will look at different colors differently. So it's also a reflection on the training that we receive throughout medical education.
We have so many dark-skinned physicians right now, and what are they doing? What are you physicians doing to make sure that this issue is remedied? Because you all have a role to play as physicians of darker skin.
It's so true. We're supposed to be advocates also, because it means we're advocating for the patients that look like us, and the patients that are unfairly maybe treated because of the color of their skin, and sometimes not intentional, but it's because the other racial groups do not understand, because they've never been in our skins or under our skins. So they do not understand how we feel and how certain symptoms will sort of show up, when it comes to darker skinned people. So we definitely have a significant role to play. And firstly, it's that acknowledgement that there is an elephant in the room. There is this critical conversation that we are not having, in our own spaces. And it may be issues of fear. And yes, we say there's a lot of, African or medical professionals of African descent. But when it comes to the hierarchy in the healthcare system, depending on the different, environments, the higher you go, maybe the picture might be different, and the fear of starting an uncomfortable conversation, and the fear of possible repercussions, when it comes to courage, the possible repercussions of, of raising such questions or elevating such issues. But we do not have a choice. We have to do it, because if we don't, nothing is going to change. We also have to acknowledge that there is a gap when it comes to the material, which is the textbooks, which is clinical guidelines, etc., where it does not acknowledge people that do not have a fair skin color. So we have to start that conversation. And actually, I just want to say to congratulate. There's a medical student in the UK, Malone, I've forgotten his surname, that has started a project on minding the gap because of the skin color, and how do we bridge that gap when it comes to clinical signs and symptoms for people with a darker skin.
Yeah, thank you, Dr. Kubekha. And at this point that I actually want to mention the article that I authored in the Harvard Crimson about that medicine should not remain colorblind. And this is where this conversation, started. Can you just mention what about that article caught your attention or made you recognize the need to address these barriers?
Mm-hmm. Actually, there's a part of me that felt guilty for not for sort of accepting the status quo as this is okay, this is how things are, and this is how the clinical science look on human beings, not taking into account the different skin colors. So it raised that, and at the same time, it gave me a nudge that we have to talk about this, and we have to challenge, the system. But obviously, we need to be, intentional with regards to what we want to achieve, and also take the conversations to the right platforms. Because it's one thing to tweet hashtag XYZ and put on social media. But I think we really need to be intentional if we want to influence medical training, and if we want to influence policy.
And to our viewers, one of the things I highlighted in that article was a well-meaning nurse asking whether I had a red rash on my skin, which can never happen on a darker skin. And so back to you, Dr. Kubekha, are there some questions you have been asked by medical personnel that did not apply to you as a Black person?
Interestingly, I would say I haven't been a patient much, except for the ear problem that I have. And most of the few practitioners that look after me look like me. Yeah. And some of it may be influenced by it's people that I'm comfortable with, people that I know. Some of them maybe we trained together, they were my seniors and stuff like that. So I do feel comfortable. But as a clinician, we've also experienced, issues related to the skin color, where you are a physician in charge and you have your white coat and your stethoscope, and the patients or family members, they actually ask for the physician. And there you are in front of them, but because of the stereotypes, etc., and sometimes they will ask you if you've checked the recommendation or the care plan with your seniors, etc. And so both sides, there is that experience of being treated differently because of the color of our skins.
Yeah, and I mean it's one of the other things that which is predominantly on the CDC website is, again, you mentioned it earlier, the bluish purple lips. So I hope that, the medical field can actually address some of those challenges and tell us what the bluish purple lips look on a dark skin. But which will take me right next into the next question. In what ways do beliefs, attitudes, and dispositions of Africans contribute to some of these disparities in healthcare? Or are there any that contribute to it?
Yes, there are. I mean, if we look at culture and how it influences health and also health-seeking behavior, So if we look at how it influences health, it's basically, maybe cultural practices, that will differ from one group to the other, And if you look at the health-seeking behavior, also has to do with the socialization. and the interpretation of a medical condition in a specific community. And I'll give an example of schizophrenia. And you find that, yes, it's a schizophrenia, it's a medical diagnosis, it meets a certain criteria, hence that diagnosis, we come to the diagnosis. And then if you take the same patient and maybe coming from a very traditional rural community that believes in traditional and indigenous medication and practitioners, and also that would associate that illness, whether one, it could be a spell from some, dark force. So if that is the belief, so that patient will not be taken to a hospital, but will probably be taken to a traditional healer that will address that. And then if you take the same patient maybe to some religious community that believes that it's a punishment from God, so you need to be redeemed and people need to pray for you. So culture, religion is part of culture. So culture has a significant impact when it comes to health itself, and then also when it comes to its influence on health-seeking behavior, because of how the diseases are perceived in those communities.
So how can we what are some of the remedies we have for that particular incidence? If culture, beliefs influence or contribute to these disparities, what can be done?
I think addressing the problem firstly is acknowledging that there is a gap that needs to be addressed, and then creating that awareness throughout the healthcare system, from training to healthcare delivery. And then it's how the question that we need to ask ourselves: how do we integrate the interventions in health education throughout the medical career, and also in when people have qualified in continuous medical education, because this is a problem that is not going to solve itself unless we talk about it. We also need to have those policies that enables the implementation of interventions that are aimed at addressing these disparities that are linked to culture and skin color.
And then more broadly, how can we make healthcare access for darker people a reality?
So firstly, we need to acknowledge the gap, and then identify the causes of this gap, the knowledge gap, and policies that are enabling disparities, and then address that at a system level, which is policy issues. Address that also at a medical education, undergrad and postgrad, and as part of continuous medical education. But also, it's just creating awareness in the general, society, because the recipients of care and people that are thinking twice before accessing care, we also need to reach them and make them feel comfortable that if they, access care, they will be received well, they will be treated with dignity, and that they are differences, if I may say, also will be taken into account, and those differences will not, subject them to a lower level of care.
Thank you, Dr. Kubekha. You just reminded me of recently, just maybe a couple of weeks ago, a good friend of mine got vaccinated at one of the big hospitals here, Mass General. It's one of the biggest in the area. And he was given a post-vaccination brochure of what to look out for after vaccination, some signs. And there were only 2 images of skin, and they were all light skinned. And this is a Black man from Mali, an immigrant from Mali. And he quickly called me and said, "Hey, Viv, I've just been given a brochure to what to look for. And just like you mentioned in your article, it only has light skin. And this is one of the big hospitals here. So where do we turn to if we need dark skin?" And I had no response to that, but I certainly, this is one step of raising awareness. So having you to talk about issues like this as a physician and also as a Black person, I think is going to start? Well, there are some conversations ongoing. There is some work that is beginning to happen, but a lot of work needs to happen. Do you have any? Go on.
Yes, on my side, I actually thank the pandemic, COVID-19, for, casting a spotlight on all these, inequities. And even the example that you just gave now, of your colleague or a friend that went for vaccination, and it is triggered by, COVID-19. But the main thing is, now that we know, what do we do with that information and what responsibility do we have? And we do have a responsibility of ensuring that, there is that awareness and understanding, and that care that is provided to people from different racial groups is equitable and dignified.
So is there any final word you have for our viewers about this topic?
Yeah. Human beings are human beings. We're all the same. We may look different, but we are all the same. We experience pain the same, and therefore we deserve to be treated the same. And the fact that certain groups, if we talk about minorities or people that are vulnerable and they don't understand their rights, we need to go an extra mile of making sure that the gap that is there is actually taken care of. We need to go an extra mile for vulnerable populations to make sure that their voices, even if it's not through their mouths, their voices are heard, and something is being done about it. And so that we can influence, how we deliver the care and how we plan to deliver the care.
Well, Dr. Kubekha, it's been an honor and a pleasure hosting you today to talk about healthcare access for darker-skinned people. Thank you for making the time to speak to us and share your experiences as a physician.
Thank you so much for having me. Thank you.
Well, to our viewers, if you want to watch more Whitefield episodes, you can check out the ActonTV YouTube channel. And you can also write to me at vivian.birchall@actontv.org. Thank you for watching Whitefield. Till next time.